Hello everyone, this is a video about the successful treatment of a case of mast cell activation disorder or syndrome. Before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So I've been doing a little video series here about successful outcomes for certain case types. Someone had posted a comment on one of my other videos saying something like, just be nice to hear about some success stories, because those of us who are in the throes of dealing with Lyme or mold or whatnot, be nice to hear about a successful outcome so that it gives us a bit more hope. So I thought that was a great suggestion, and so that's what I've been doing. So I've done a video now about a successful treatment of persistent borreliosis or chronic Lyme disease, mold toxicity, and then I did one recently about POTS, which is a form of dysautonomia. So today is one about histamine. So what's a little bit tricky about histamine is that it's it's challenging to talk about a MCAS case or histamine issue case with somebody who isn't suffering from mold illness or some chronic infection or SIBO or some type of notable gut dysbiosis going on, because it's just kind of a feature of a lot of it's a feature of those conditions in many cases, and oftentimes there's multiple underlying causes. So this is, anyways, a case where it's mostly just a histamine focus. So figured it would be a good example. So this was a patient that I saw, oh my gosh, I don't even remember it. This was probably about maybe 8 years ago or so, give or take. So quite a while ago. And this patient was a younger person at the time, late teens, maybe not quite in his 20s. I think late teens, maybe somewhere in the 16 to 18 range, give or take, and was just having a heck of a time with just being itchy all over. Was having rashes, having issues with his heart rate elevating out of nowhere, feeling really anxious for no particular reason, like not due to any particular stressors or circumstantial factors, just getting like these bursts of anxiety, and I was having like some fatigue and brain fog, and was just feeling pretty stressed out about like what the heck was going on with his body. It was also really frustrating because he was a fairly athletic guy, but whenever he would exert himself, his symptoms would all get worse. So he was kind of beside himself, and so he'd been worked up for some conditions. We ruled out this condition called pheochromocytoma to rule out why he was having these bursts of anxiety and whatnot. They'd done some basic blood work on him and just basically couldn't figure things out. He'd kind of gone through like, is it you're reacting to your laundry detergent and this and that, and like just couldn't seem to figure anything out. So he was just kind of sort of at his wit's end. Was taking some cetirizine, for Canadians listening, that's Reactin. For Americans listening, that's Zyrtec, and they have other names for these too, but those are kind of common second generation antihistamine, and that was helping a little bit, but not a ton. And so anyways, parents brought him in to see me, and we had to chat about things, and all the symptoms he was experiencing was like, oh, this is histamine. So of course the rashes and the itchiness, but also the elevated heart rate and feeling anxious, because histamine is an excitatory neurotransmitter in the brain, and the whole picture just screamed of histamine. So of course, being a clinician who strives to do his due diligence, I asked, well, when did this all come on? And it all seemed to come on after a pretty notable physical injury. I don't remember the exact nature of it. It was something with a lower limb. This is 8 years ago, so I'm going back a bit. But there was notable injury, a lot of severe pain, and then it's just that seemed to trigger things off where there's like a little bit more histamine type symptoms, like a little bit of like itchiness, a little bit of rash, but then it just gradually like kind of progressed. And so it seemed like it was kind of a stress induced trigger. And so when it comes to looking at all the things that can activate mast cells, basically pick something. So many things can activate mast cells, whether it's an infection, whether it's a toxin, whether it's physical trauma, whether it's emotional trauma. There's a lot of things that can trigger mast cells, and unfortunately histamine tends to be, histamine in folks with mast cell activation syndrome has what I kind of refer to as a bit of a self-fulfilling prophecy component to it, where mast cells, which are these specialized white blood cells that contain histamine and a whole bunch of other chemicals that can perpetuate an allergic type response, they actually have receptors on the outside of them for histamine. So the more histamine that's in the body, the more that the mast cells get activated, which releases even more histamine. So there's even more histamine to bind to more mast cells to release even more histamine. So it's this, this amplified amplifying effect. And thankfully, our bodies have these fail-safe mechanisms or checks and balances to break down histamine if there's too much histamine kicking around, but those systems don't always work optimally. There's different, we have different genetics that kind of dictate how good our bodies are at putting out those histamine bursts, so to speak. And then if there's ongoing stressors, so like say for this individual, he was in a lot of pain, he was really stressed out because it was going to interfere, like I can't remember if he was on track to be in the Olympics or something, but like he was on track to be competing at fairly high levels, like, oh, I had this major injury, like, is this going to, affect my future career, this and that, like there's just a lot of physical and mental emotional trauma happening, and so it seemed to be perpetuating this in his case. And then once the pattern kind of got set, it just didn't seem to be able to break, so to speak. A person who's having MCAS because they're living in a moldy home, it's like, well, if you can manage to remove yourself from the moldy home, then hopefully that mast cell trigger will be resolved and things will settle down. In some cases, even when a person's out of the moldy home or they're the physical trauma has been healed or whatnot, sometimes there's just this perpetuation of histamine symptoms and they just don't seem to want to go away. So with this patient, I recommended some fairly basic first-line therapy, and not that this is the approach I would necessarily take with every patient, but I asked him about his diet. He was eating a lot of really high histamine foods, so I was like, well, a low histamine diet's not imperative for every patient with MCAS by any stretch, but I recommended that he go on a low histamine diet because he was eating lots of bananas and citrus fruits and spinach and strawberries and beans and things like that. So just a lot of high histamine foods. So I recommended that he go on a low histamine diet, and then I also recommended that he take his Reactin on a regular basis. I also recommended that because he was kind of just taking it like when symptoms seem to get really bad, it's like I recommend that you take this on a really consistent basis because we want to try to squash the histamine as much as possible. Again, where more histamine means more histamine release, by blocking those histamine receptors, it's going to make it harder for more histamine to be released. So just as histamine can kind of bloom and really expand rapidly, unfortunately, by the nature of the physiology around histamine, as you start to reduce the histamine, then it's going to, the more you reduce the histamine, the faster it's going to actually get those levels down. So the same kind of relationship works in reverse, so to speak. Unfortunately, it doesn't go down as quickly as it can go up, but the more it goes down, it'll go down faster and faster, the more it goes down. So I think I also recommended some quercetin as a mast cell stabilizer as well. So the patient came back, I think it was a few weeks later, with histamine. One of the good things about histamine, quote unquote, is that it tends to react very quickly. So if a person's getting better from histamine, assuming that the root cause factors have been addressed or are being addressed, then the symptoms can improve pretty rapidly. So we didn't have to give them 2 months to see like, okay, are we seeing any change? Followed up a few weeks later. So when he came back in, he was doing quite a bit better. Things were a lot more stabilized. He wasn't really having those anxiety spikes happening, which was really nice. His heart rate was staying pretty stable, but the itchiness and the rash were still, the itchiness was still pretty notable. I think it had gone from like a 8 or 9 out of 10 down to maybe a 5 or a 6. So it was better, but it was still not obviously resolved. And he was doing pretty well with the low histamine diet. I think he was like 75-80% compliant. So I recommended that he keep up the diet, keep up the Reactin, keep up the quercetin, but I also recommended that he go on a first-generation antihistamine, so Benadryl or diphenhydramine, because Benadryl, just clinically, it can pack a lot more punch for for folks who are dealing with histamine issues. And then also, Benadryl is a first generation rather antihistamine, so it crosses the blood-brain barrier, whereas second generations don't. And so, in some cases, a very meaningful component of a patient's MCAS case is coming from a central nervous system based mast cell activation happening. So sometimes bringing in the Benadryl really makes a big difference. So he was still sticking with the quercetin, the diet as best he could, the Reactin, and then Benadryl before going to bed. Side effect of Benadryl is makes you drowsy, so some people use it as a sleep aid actually. So we took it before bed, and that seems to be a good fit for most people. Good timing for it. So he came back in a few weeks later, and he was doing quite a lot better. Symptoms were down to maybe like 2 or 3 out of 10 for the itchiness. The rashes were a lot more infrequent. Wasn't having any of the other like anxiety symptoms, heart rate increases, etc. So he's doing quite a lot better. And so this. Looking back, okay, so why was he doing that much better? Well, in my opinion, the reason why is because we were just squashing that histamine that much more intensely. So, he's cutting it out of his diet, stabilizing those mast cells, blocking histamine receptors inside and outside of the central nervous system, and we were just kind of corralling that histamine and just playing the waiting game, basically allowing things to just settle down more and more and more. Because again, just as histamine can rapidly bloom up, it can methodically reduce over time. So just kind of finding the right dose or the right combination of supplements or medications to help regulate the histamine as best we can, to make to help a person be as comfortable as possible, and then just buying time, waiting for the histamine to settle down, the mast cells to settle down, and everything to kind of go back to sleep, so to speak, and from a histamine perspective. So we stayed the course, followed up maybe another 3 or 4 weeks later. He'd been doing really well, and so he was not having the symptoms anymore. So we started tapering off the diet, tapering off the medications and everything. I tend to really treat histamine cases with kid gloves. Once we get things corralled, I don't want to misstep and take someone off of a supplement or a medication too quickly. That might lead to them having a rebound histamine issue, because again, when it goes down, it's great, but if you misstep, then things can increase again pretty quickly. So in his case, I just recommended that we do a fairly slow taper of his dosages, and over the span of maybe a month or so, he was down to nothing, had no flare-up symptoms, and was just good to go. So I haven't heard anything from him since. It's been 8 years, so I hope he's doing very well, whatever he's doing, and hopefully not having any issues with histamine. So anyways, that's a kind of very histamine-centric case, without the confusing or confounding factors of mold and Lyme and Bartonella and SIBO and things like that. So I hope that was of interest. If anybody has any questions about this case or anything related to histamine, feel free to post in the comment section below. I'm planning to do 1 or 2 more of these successful case outcome videos. I'm planning to do a heavy metals one coming up, and had another idea for one. Oh, maybe I'll do a SIBO one or something like that. But if there's a topic that you're interested in hearing about, a successful case outcome about, feel free to post that in the comment section, and I can certainly do one about another topic that's not heavy metals or SIBO or whatever else I think of before I post my next video. So I will leave it there for now.